it comes to the aches and pains of pregnancy, our low back and our SI joint can be a huge reason we experience so many aches and pains. My name is Dr. Nicole. I'm a physical therapist and a mama, and last week we talked about all the ways we can stretch to relieve back pain, and today we're going to talk about all the ways we can strengthen in order to keep that back pain away during our pregnancy. When it comes to strengthening during pregnancy, I think there's 3 areas we really need to focus on if our goal is to get rid of back and SI joint pain. The first of these areas is our core. It's a myth that you can't strengthen your core during pregnancy. You absolutely can. You just might need to modify the things that you were doing before you got pregnant. Your core, what I'm referring to, is not those six-pack muscles that are probably long gone at this point. It is your transverse abdominis, or I'll also refer to it as your TA muscles. This is a very deep core muscle that starts at your spine. It comes around like a corset and it connects in the front. Of course, during pregnancy, it's not as tight-knit in the front as it once was because our growing bellies are causing it to stretch. But we absolutely can still strengthen our core, and it's a great idea to do so because we want to make sure that we are decreasing our risk for things like diastasis recti or separation of our abdominal muscles after we give birth. So this probably isn't going to prevent that separation totally, but hopefully it will minimize it, and also you'll be ahead of the game because you'll know exactly what to do to strengthen it and tighten it back up after you give birth. So the best way to engage your transverse abdominis muscle is by thinking about a string on your belly button, pulling it down towards your spine, thinking about zipping up the front of your core and bringing the sides of your stomach together. You can also think about the tightening that might occur if you tried to put on your pre-pregnancy jeans at this point. All those things are good cues to your brain for activating your transverse abdominis muscles. I would highly recommend you check out @GetMomStrong on Instagram for tons and tons of creative ways to strengthen your core. The big thing is by moving your arms and legs, you can challenge your core without ever twisting or crunching up with your core muscles, which are often a little too challenging for us during pregnancy and just not really comfortable anyways. But there are lots of ways we can use resistance bands or weights or even just body weight activities to strengthen our core. And truly our core should be activated anytime we lift anything, anytime we are pushing or pulling something. And if we engage it all the time, it's going to be that much stronger. The other thing with strengthening our core is sometimes we try an exercise and it actually makes our pain worse. But if we contract our TA muscle in the front before we do that exercise, it actually makes the exercise more comfortable so we can work on strengthening our hips and low back without feeling that discomfort. In addition to that, you should be strengthening your glute muscles. You actually have 2 sets of glute muscles, the side glute muscles, which is called glute medius, and the butt glute muscles, which is called glute maximus. You want to make sure you are strengthening both because these are great stabilizers for our pelvis, and they are going to take some of that pain out of our low backs if they are strong and doing their job correctly. Different ways you can strengthen your glute muscles are pretty common. You've got bridges, you've got donkey kicks, you've got lunges and squats. You can be on all fours and do what I call a bird dog exercise. So many ways you can strengthen your glute muscles. Some keys to make sure you're avoiding are if you're in a standing position when you strengthen your glute muscles, try to keep your trunk up nice and tall. When we lean forward, we might actually be using our low back, which is probably already strong and overworked, and that's why it's painful in the first place. So make sure you have good posture during strengthening. Also, like during things like bridges or donkey kicks, if you squeeze your glute muscle first and then you do the bridge, or you squeeze your butt muscle and then you do the donkey kick, you're going to activate and use that muscle rather than calling in some of your already strong muscles like your low back and your hamstrings. During your glute exercises, don't forget to keep your transverse abdominis or your TA core muscle good and tight. because again, this could make the activity a lot more comfortable, and it's good to be working all of our muscles together. We really shouldn't be isolating muscles. We want to be using our whole body together. And the third key to stability and strength that is going to relieve low back pain during pregnancy is making sure that our pelvic floor is staying strong. Now, the extra weight of baby and all those extra fluids that are carrying around is putting a lot of pressure on those pelvic floor muscles, which are acting like a hammock at the bottom of our whole core system. This is kind of the floor of our core. The key to this is making sure we're strengthening in a couple different ways. You want to make sure you are strengthening for endurance, which is holds. So you exhale and lift up your pelvic floor muscles, and you want to try to hold for as long as you can before it starts to just fizzle out and no longer be a good contraction. And try to do a few of those in a row. But beyond endurance, you also want to strengthen for like power, which is a max contraction. And this is the kind of contraction you need to make sure you're not leaking when you pee or sneeze. So much we could say about that. Whole nother video about incontinence. I'll go ahead and link that above, so click right there and watch that video next if you are experiencing incontinence during pregnancy. But for the purposes of this video, just make sure that you are doing a quick, tight squeeze with your exhale and trying to close it as tight as possible, as quickly as possible, in addition to those endurance exercises where you're trying to hold your pelvic floor contraction for a good 10 seconds. I've talked about this before, but if you time your contraction where you inhale as you relax your pelvic floor and you blow out or exhale as you squeeze, lift, and tighten your pelvic floor, you're going to get the most out of this exercise. Sometimes we tend to glaze over the fact that there is a relaxation portion of a Kegel exercise. I mean, if we went to the gym and we were doing bicep curls, you would want to rest it at the end of the curl. You wouldn't just always be contracting a little bit and working in this really small range. And the same is true for our pelvic floors. Some women are actually so tight in their pelvic floors because they never learn how to let it relax. And so as you inhale, you should feel your pelvic floor muscles completely opening, relaxing, dropping down. And this is especially going to be important during your labor process, because during contractions and pushing, you want to know how to keep your pelvic floor open and relaxed, or it's going to be very difficult for you to deliver your baby. So there you have it. Those are the 3 areas I think you should keep strong during your pregnancy: your core, your glutes, and your pelvic floor. There are so many exercises you can do for your core and glutes. Just make sure that you are following someone that is aware of the changes with your body during pregnancy so that you can make sure you are strengthening in a safe way. And of course, if exercises are causing you more pain, think, did I contract my TA muscle when I did that? And if it's still causing you a lot of pain, it's probably a little too advanced. You might need to modify it a little bit or just try a different exercise, because like I said, lots of ways to strengthen these things. There's no reason to do the ones that are causing you more pain. The question of the day today is, what do you think is weaker for you? Your core, your glutes, or your pelvic floor? I would love to have you subscribe to my channel if you want to see more videos about things you can do during pregnancy, labor and delivery, and postpartum to help you have a good birth experience. And I'd love to get a thumbs up if you liked or learned something in this video today. And as always, I look forward to seeing you all next time.